Artificial Intelligence Dr. www.abcpharma.net/English. Can you give me questions related to anesthesia in implanting leadless pacemaker and names of the most anesthesia drug used in that procedure? GPT-4. When discussing anesthesia for the implantation of a leadless pacemaker, there are several key questions that can help elucidate both the process and the specifics of anesthetic management. Additionally, understanding the commonly used anesthetic drugs during such procedures can assist in comprehending the safety and comfort considerations. Here are relevant questions and information about the anesthesia used. Questions related to anesthesia for leadless pacemaker implantation. 1. What types of anesthesia are commonly used during the implantation of a leadless pacemaker? 2. How do anesthesiologists determine the appropriate type and dose of anesthesia for patients undergoing leadless pacemaker implantation? 3. What are the specific risks or considerations associated with administering anesthesia to patients with cardiovascular issues undergoing pacemaker implantation? 4. How does patient age or comorbid conditions affect the choice of anesthesia during leadless pacemaker procedures? 5. What are the protocols for monitoring patients under anesthesia during the implantation of a leadless pacemaker? 6. Can local anesthesia alone be sufficient for leadless pacemaker implantation, or is sedation typically required? 7. What are the common side effects or complications associated with anesthesia in leadless pacemaker implantation? 8. How does the anesthesia management differ between leadless and traditional pacemaker implantations? 9. What are the recovery protocols regarding anesthesia for patients who have undergone a leadless pacemaker implantation? 10. Are there any new advancements or techniques in anesthesia that are particularly beneficial for leadless pacemaker procedures? Common anesthesia drugs used in leadless pacemaker implantation. The choice of anesthesia drugs depends on whether the procedure requires local anesthesia with sedation or more extensive anesthetic management. Here are some commonly used drugs. 1. Local anesthetics. Lidocaine, frequently used to numb the insertion area, it provides local anesthesia and is effective for short procedures. Bupivacaine, another local anesthetic that might be used due to its longer duration of action compared to lidocaine. 2. Sedatives. Midazolam, a short-acting benzodiazepine, it is used for its anxiolytic and sedative properties, making the procedure more comfortable for the patient. Propofol, often used to induce sedation, propofol is administered intravenously and allows for a quick recovery post-procedure. 3. Analgesics. Fentanyl, a potent opioid analgesic, it is used for pain control during and immediately after the procedure. It acts quickly and has a short duration, which is ideal for procedural sedation. 4. Additional agents. Depending on patient needs and the duration of the procedure, additional agents such as dexmedetomidine, a sedative with analgesic properties, may be used. This drug is useful for maintaining a level of sedation that allows the patient to be comfortable yet easily arousable. These medications may be used alone or in combination, depending on the patient's medical history, the complexity of the procedure, and the anesthesiologist's plan. Always, the approach to anesthesia should be tailored to ensure patient safety, comfort, and optimal conditions for the procedure. Claude AI. Certainly. Here are some questions related to anesthesia in implanting leadless pacemakers, along with the names of the most commonly used anesthesia drugs in this procedure. Questions. 1. What type of anesthesia is typically used during the implantation of a leadless pacemaker? 2. How does the anesthesiologist monitor the patient's vital signs and level of sedation during the procedure? 3. Are there any specific considerations or precautions for anesthesia in elderly patients undergoing leadless pacemaker implantation? 4. How does the anesthesiologist manage pain control during and after the procedure? 5. What are the potential side effects or complications associated with the anesthesia used in leadless pacemaker implantation? 6. How long does it take for the patient to recover from the anesthesia after the procedure? 7. Are there any pre-existing medical conditions that may influence the choice of anesthesia for a patient undergoing leadless pacemaker implantation? 8. How does the anesthesiologist collaborate with the implanting physician to ensure the patient's safety and comfort during the procedure? Most commonly used anesthesia drugs. 1. Propofol, a short-acting intravenous sedative that is often used for moderate to deep sedation during the procedure. It provides rapid onset and offset of sedation, allowing for quick patient recovery. 2. Midazolam, a benzodiazepine sedative that is commonly used in combination with other anesthesia drugs to provide anxiety relief, amnesia, and sedation during the procedure. 3. Fentanyl, a potent opioid analgesic that is often used in low doses to provide pain relief during the procedure. It is typically administered intravenously. 4. Remifentanil, another opioid analgesic that is sometimes used as an alternative to fentanyl. It has a rapid onset and a short duration of action, making it easier to titrate and control during the procedure. 5. Lidocaine or bupivacaine, local anesthetics that may be used to numb the implantation site and provide additional pain control during the procedure. It's important to note that the specific choice of anesthesia drugs and techniques may vary depending on the patient's individual needs, medical history, and the anesthesiologist's preference. The anesthesiologist will carefully assess each patient and tailor the anesthesia plan to ensure the safest and most effective management during the leadless pacemaker implantation procedure.